This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
My name is Elikim Dorbu. I'm a PGY4. As Dr. Benjamin said, I'm the wellness chief for the 2024 to 2025 academic year. It's a pleasure to be speaking to you all today. And I'll let Dom just introduce himself really quickly, and then I'll get started on the presentation.
Hey everybody, my name is Dom Corsello. I'm one of the PG4s as well. We've got 5 here, so you got 2 of the 5 here. And I'm the advocacy and outreach chief this year. So I've just so you know, I've got my contact info in the chat. If anybody ends up with straggling questions or whatever, I'm happy to answer those later on. But we'll see what we can get to today.
Okay, so let me share my screen, and then let me hit. That should be fine. So I'm going to start with a little brief overview of Schwab. And there's a little subtitle screen there too, if you'd like to see that. So this is kind of a picture of the hospital from atop. As you can see, there's our beautiful rooftop garden that we try to get our patients to go to during the summer and spring, and even the fall as well. To kind of continue from there. So the overview of this presentation is who we are, kind of a brief summary of our clinical rotations, education, benefits, just a brief look at our faculty, our current residents, and then we'll have space to let you guys answer or ask questions. If you have any questions, you can just put them in the chat, and then we can answer them as we go along. So to kind of give kind of a brief overview of our mission statement, our goal is to develop rehab physicians who practice with a social conscience. Just as Dr. Gittler was saying, it's really important for us to be able to take care of patients from a wide variety of different socioeconomic statuses, racial, ethnic groups, genders, and sexualities as well. And with a lot of these patients, we often try to address multiple parts of some of the social determinants of health that affect how they got to us and how we can help them in the future. So if that is something that's really important to you and is something that's resonated with you throughout college and med school, then I definitely recommend you give us a look. We're located in Chicago's west side on California and Ogden, if you're familiar, which is close to the medical district where some of the other med schools and hospitals are in the city. And in that area, a lot of our patients struggle sometimes with food insecurity, with housing, with high crime. And, we try to address like each of these topics when we're taking care of our patients while they're with us. So here's kind of a YouTube video of our old virtual tour. That's our therapy dog, Murphy. She's incredibly sweet and an incredible angel. So if you do get a chance to come to Schwab, hopefully you'll be able to see her. We are updating our virtual tour video as well, so that will come later on in the year. But this is a pretty good overview of what Schwab looks like. I think Dom posted that in our comment section as well.
Yeah, I did. If we've got time to come back to it, we can, but otherwise, yeah, feel free to watch it on your own.
Yeah. So kind of an overview for us. So like I said, we're located on Chicago's west side. We are a freestanding rehab facility that is partnered with Mount Sinai Hospital, which is across the street. But we get patients that come from hospitals across not just the Chicago area, but Illinois and sometimes across the country as well. We've had patients come from Iowa before. I think also patients from the South as well. We have 60 inpatient beds. We also have outpatient physician clinics and an outpatient therapy gym. And a new addition for us from last year is that we now are using Epic. So for those of you that are familiar with it, it has definitely streamlined a whole lot of stuff that we do in the hospital. So definitely something to look forward to because some programs don't have Epic. We also have affiliations with the University of Chicago hospitals, UIC, and like I said, Mount Sinai, which is across the street. And we are a 3-year advanced residency program with 5 residents per class. So essentially you do your PGY 1 year at one location, and then you would come to us for your 2, 3, and 4 years. We also have academic affiliations with Pritzker, which is UChicago's hospital or med school, and UIC as well. And with that, you have access to some of their learning materials as well. And you also get ID badges too for these places to let you into different areas of the hospital. To kind of give an overview of our PGY 2 year, so we have 5 rotation blocks that basically happen at Schwab. You have general, stroke, spinal cord, brain injury, and then our outpatient clinics, which our PGY 2s and most recently our PGY 3s were taking a big advantage of and trying to see as many different clinics as possible. You get one-to-one faculty to resident ratios. You get faculty membership as well. You get mentorship of med students that come and rotate at Schwab, and participation in the hospital committees that exist, like our antibiotic stewardship, fall prevention, et cetera, et cetera. These are kind of the breakdown of the rotations that we have. And you can see a wide variety of patients this way as well. Moving on to PGY 3, that becomes a little bit more outpatient focused. We recently created a hybrid rotation for spasticity, subacute, long-term acute care, and wound care that happens in a 5-week block. Some of our PGY 3s are going through that right now. And I think they're doing a good job of going to the rotations, kind of giving feedback, receiving feedback for ways to continue to improve it. We have inpatient consults at University of Chicago with Dr. Benjamin as well. Pain management opportunities at the University of Chicago with their interventional pain fellowship program. And then opportunities elsewhere, such as at Elmhurst, which is a hospital in the suburbs, and sports and spine management as well. So you get to see a whole lot of different kinds of medicine practiced by different fields as well, and different attendings that have trained through PM&R and other fields like that. We also have electrodiagnostic medicine too at Schwab and at the University of Illinois, which is led by a neurology service. So you get kind of a PM&R aspect to electrodiagnostic medicine, and you get a neurology aspect as well. You also get to do MSK / sports medicine at UIC with Dr. Verma, and now 2 new attendings that have also joined. And with that, you also have opportunities for sports and sideline coverage, and opportunities to work with college athletes as well. And finally, we also have a pediatric rotation at Shriners Hospital. There you can see different patients from all around the world with different conditions, from cerebral palsy to amputations as a result of severe sepsis. And it's kind of a really cool rotation that we do. It's also, you can also do it in your 4th year as well if you find yourself interested in pediatric rehab. And it's a 5-week block. And then this is just a picture of the University of Chicago Hospital. So it's located in the South Side. For our consults, you can see, level 1 traumas, strokes, TBIs, SCIs, amputations, the whole 9 yards. There's weekly trauma rounds as well, and you do get a personal office space, which is really nice because you can just kind of sit there and work on your stuff, and you kind of have it all to yourself. It's one of the favorite parts of my rotation, honestly, was being able to kind of do my work in there, and pretend that I was, super cool. moving on, you have the University of Illinois Flame Center, but that's where you do a lot of sports coverage, and you can get a lot of sideline sports coverage too. Dr. Verma, who is kind of the main attending there, is also a Schwab alumnus, and he is a wealth of knowledge when it comes to all those procedures that you see over there, sports coverage, applications for sports fellowship as well, athletic training, all of this kind of stuff. He really likes working with residents and working with this fellow. So, we're really grateful that we have this partnership with him. Electrodiagnostic medicine. So if you're not familiar with that, that's like EMG, nerve conduction studies. Like I said before, you work with PMR and neurology in this rotation. You get a lot of emphasis on technical execution and interpretation report writing. You also get access to AANEM, which is the National Association. And for pretty much everyone that's gone through it, it's really easy to hit your minimum cases, which is about 250 plus. But you get a lot of opportunities to do that. To kind of move to PGY4, where we're at, it's kind of a combination of both, a little bit of choose your own adventure almost. We do inpatient consults at Mount Sinai Hospital with one of our attendings, Dr. Saxena, which is a really fun experience because you see a different side of how to approach consult medicine. We also have junior attending experience as well, which is cool for people considering inpatient work. And then you can also get exposure to subacute rehab, which is what I'm seeing right now. Further, you can get more EMG exposure. You can get stuff with PT, OT, prosthetics, orthotist, neuromuscular medicine, more outpatient rehab, 8 weeks of electives, and then a quality improvement project as well. And you can do that throughout your PGY 2, 3, or 4 year. You definitely get more dedicated time PGY 4 year, but that's definitely available as well. Just a brief slide that just shows the procedure requirements for PMR. It's really easy to hit pretty much all of these at Schwab. That's the main point about that slide.
And you have 5 minutes remaining.
Okay, cool. Kind of go through things quickly. This is just our educational aspects. You have opportunities for both self-directed learning and group learning too, with residents and attendings. And very briefly, we have our benefits here. So 15 days vacation, 3 personal mental health days throughout the year. We get 6 holidays off, an education fund, conference fees, conference stipends as well, and days for interviews. This is just a brief breakdown of our call. As you can see, each year it goes down. And we try to make the call, we try to get PGY2s to get into call as easily as possible. Here's our brief overview of our faculty. You can see here. Here's a quick picture of our residents. I'm going to throw it over to Don really fast, though.
Yeah, okay. So, I mean, for the remainder, just real quick, because I know we want to have some time for some questions. If we can hop on to the next slide, Elkem. Of course, we're based in Chicago. Chicago's a great city. I'm happy to answer anybody's questions about Chicago, but I can tell you without a doubt, I've had a really good time here. It's a pretty manageable, big city. I feel like our program is pretty family friendly. I am right now the only person who's actually got any kids here. I've got 2 little boys, both preschool age, but I can tell you the main headline there is that it works. It's reasonable. We can always work to make things like that happen. So if you have a family, planning on having a family, that's really totally fine here. We have some outreach activities we can do. Camp Schwab is an event that's coming up where we have a bunch of kids with disabilities come out, and we help them have a few fun days out in the park, out on the beach, doing some sailing. I got to the beach last year, and it was really cool. We also have some opportunities for sideline coverage to help out with marathons around the city. So there are ways to get out and get involved with our program, and really a lot to explore as far as kind of getting a good feel for what's out there and what you can do with the training you've had so far. And then lastly, our program is housed in a hospital that doesn't have a ton of resources for getting food nearby, so we do have a Costco fund every month. We spend several $100s at Costco bringing a bunch of food here, and we're all pretty well fed overall. So with that, I think if we've got any time, anybody's got any burning questions, you can go ahead and ask them now. Anything that goes in the chat, if we don't get to it here, we'll try to get back to you by email if you provide that.
Awesome. Excellent timing. You have 2 minutes remaining.
Okay, and I see in the chat we've got a question about the cutoff score for Step 2 CK. I don't think that we have, correct me if I'm wrong, but I don't think we have a hard cutoff there.
We do not have a hard cutoff.
I put in the chat. We do consider applicants who also may have had a failure. So please don't consider that a reason not to apply. Again, we are looking for applicants, like we look at the whole picture, and we're looking for applicants that bring more than just their scores. So definitely please apply. There's a question about opportunity for early involvement in P&O, and the answer would be for sure, whether it be on the inpatient rotations, there is incorporation of P&O, or in the outpatient rotation as a PGY2 as well. But there is dedicated time for P&O in your 4th year as well. And I think there was a question also regarding didactic session. So not all of our didactics are virtual. We do encourage now, since we're past COVID, we do encourage our lecturers to come in person. But if there is a need, we are happy to accommodate virtual lectures. So we would be happy to have anyone participate in our virtual didactic if there is one that's scheduled for that day. And I would encourage you to reach out to either Alakim or Dominic, and we can also put you in touch with our academic chief to see if that would potentially work out. Okay. There was also a question about residents having unique interests within physiatry that weren't part of the core curriculum. And I would say there's definitely opportunity to explore that during elective time. In the PGY 4 year, we're very generous with our elective time, and you can actually go outside of the system, which is different than some of the other programs. So elective time does give opportunity to go outside of the core.
Awesome. Thank you.